I'm going to go ahead and demonstrate how you do each pre-assessment. So if you go to Talon, print off your sheet, this one says thorax. I'm going to demonstrate the pre-assessment. This is what you have to do at the start of lab with your lab instructor on the mannequin, and you can use your sheet as a guide. Okay? So first I'm going to come in, I'm going to raise the bedside table. It's always good practice to wash your hands. Okay, this patient, his name is Bob. So Bob, I'm going to go ahead and ask you a couple of questions regarding your lungs. Do you have any history of lung disease or any lung trouble? We'll say he says no. Can you tell me about your breathing? Do you feel short of breath? No troubles? Okay. Do you have a cough? Let's say Bob says yes, I have a cough. You would say, could you describe it to me? Is it productive, non-productive? Is it just in the morning? And then the patient would tell you kind of what they're having. And then, do you smoke? Bob says, yes, I smoke. I ask him how many packs. He says 1 pack. And for how long have you been doing this? 50 years. Okay. Bob, are you interested in quitting at all? And he says, no, not at this time. Okay, so those are the subjective questions that you would ask. Then I'm going to inspect, because we always inspect first. So I'm going to look at the breathing pattern. So I'm going to see if it's regular, if it's irregular, if it's shallow, if it's deep, and then again I would do the respiratory rate. Next I'm going to look at the shape of the chest, and I'm going to look to see if it's a barrel chest. So I'd go ahead and take a look, and he's not barrel chested. Then I'm going to look at the nail beds. So I'm going to look at his nail beds, see what color they are, and see if I notice any clubbing. Then we move to palpation. So when I palpate, I'm going to do 4 times in the front, 6 times on the back, and we use 2 fingers. We use little circles, and we just palpate using the ladder method. And I'm looking for any masses, lesions, crepitus, if he has any pain. And then we're going to go ahead and sit him up. And we're going to do 6 times on the back. So again, little circles, feeling for masses, lesions, tenderness, or crepitus, okay? And again, here we would notice that he does have a lesion. All right, then I'm going to come back and I'm going to see if his trachea is midline. So basically what you can have them do is just look up. So look up, the trach is midline. And then we're going to palpate for fremitus. And remember, this is what we did in class. So we're going to put, so to do anterior, so go ahead and say 99, and you'll feel the vibrations. Then you do it posterior in the back, so he would say 99, 99. All right, then we're going to percuss, and I just want you to percuss in 3 spots. Obviously on the mannequin you're going to have trouble hearing the sounds, but when you do it on your lab partner, you're going to hear it. What I'm looking for is your technique. So again, you're going to put the 2 fingers down on the skin. I don't want the whole hand down. 2 fingers down. You're going to curve these 2 fingers. Okay, man's just going to lay down for me. You're going to curve these 2 fingers. And that's what you're going to do. I don't want to see slapping. I don't want to see this. Curved, tight fingers. Okay. So you're going to percuss over the lung field, over a bony prominence. So you could do like the scapula, the clavicle up here, and then a muscle or like organ, and you can use the deltoid over here. You're going to do that 3 times for me. Then you're going to finally auscultate. So you're going to grab your stethoscope. Every time you feel the stethoscope touch your skin, I'd like you to take a deep breath. And again, it's 4 times in the front, 6 times on the back, and then 1 on each side on the lateral, okay? Ladder method. So take a deep breath, take a deep breath, deep breath, deep breath. On the back here. And we want to stay off the spine, stay off like the shoulder blade, so you're going to just kind of be right in this area. Deep breath. That's 2, 3, 4, 5, and 6. Then you're going to do 1 on each side. Have them take a deep breath. And then on this side, deep breath. All right. right, once you're done with that assessment, you'll move into your groups and do your documentation.